continues. This is TV3 New Day. And when it comes to the conversation about malaria, we're all involved and concerned, especially now that there's doomsday and a lot of people are beginning to sleep outside or probably opening their windows and their doorways just to ensure that there's enough air. Now, as you're doing that, you should also realize that you're inviting some mosquitoes in and out and inviting them onto your skin when you decide to sleep outside, and which is why it's important to take note of what government is doing or the nation is doing to ensure that we do not only sensitize people on malaria prevention, but we mobilize resources and encourage political conversation on ways by which we can reduce malaria infections to the barest minimum. And tomorrow is World Malaria Day, just in case you didn't know. In the studios with me, I have Dr. Nana Yao-Pepra. He's the Deputy Programs Manager for National Malaria Elimination Program. Good morning, Doc.
Good morning.
Thank you for joining me. How are you doing?
Thank you for having me.
Doc, when you look at my face, can you tell if I have malaria or not?
Not at all.
I'm just checking.
It starts from signs and symptoms.
Oh, okay.
Yeah, so if you have like fever, headache, general malaise, body aches, then we'll have to test.
I see.
Right, so test if it's confirmed, either through the rapid diagnostic test or microscopy. If it's positive, then we say you have malaria.
Right now, a lot of sicknesses come and they tell you, the first thing they tell you is malaria. So people even try to treat themselves on their own. But I didn't even realize that it was National Malaria Month. And tomorrow is World Malaria Day. So what have we done so far?
So far, I think we've seen a lot of progress in the area of malaria parasite prevalence. 20 years ago, we were having about more than 50% prevalence, meaning that if you take about 100 people, 50 of them will be positive for the parasite. Now 2022, it was estimated at 8.6, meaning that now if you take 100 people, roughly about 9 of them will be positive for the parasite, which means that we have made progress. In the area of mortalities, we've seen a reduction from 333 malaria-related deaths in 2019 to 146 last year. So we have made progress with all the tools we have available. And stakeholders last year agreed that now we shouldn't be thinking about just controlling malaria, but we should focus on eliminating malaria. And so this year, what we are looking at is how do we eliminate malaria. So the theme is health equity, the cornerstone to malaria elimination in Ghana.
Can malaria be eliminated?
Yes.
As long as you have the mosquitoes that carry the parasite, then
exactly.
How do you eliminate it?
I like this question because whenever we talk about malaria elimination, people think we are talking about mosquito elimination. The mosquito is just a vector that transmits the parasite. So what causes malaria is the parasite, not the mosquito. So for instance, in this room, if we have thousands of mosquitoes here and we all don't have the parasite, it can bite us, take your blood, but it won't have a parasite to transmit. So all the countries that have eliminated malaria, they still have mosquitoes.
But not the female Anopheles mosquito.
They could have the female, but then they have eliminated the parasite. And that is why now our focus, yes, we want to reduce the burden of the mosquito, but then we have to interrupt the transmission of the parasite.
How do you do that? Very
good. So we will still have to do what we've been doing, but now we are adding on what we call the mass drug administration. So in areas where malaria transmission is very low, especially in Greater Accra, we'll be introducing mass drug administration where we'll be giving everybody, not those with symptoms, those without symptoms, malaria medications. That is going to prevent you from carrying the parasite. So even though we're having some mosquitoes around, there's no parasite for transmission. And as we do this in Greater Accra, we learn lessons and we move it across the country. Aside that, we are introducing another intervention among school children called the intermittent preventive treatment among school children. You know, children go to school, they get malaria, they can't go continue. And so for everything, we'll be giving them anti-malaria. That's also going to reduce the burden. And then we are introducing what we call the post-discharge malaria chemo prevention. If a child goes on admission, has anemia, anemia is when your HB is low. If a child has something like that and gets malaria in addition, it's going to be very bad for that baby. So we'll be giving that child an anti-malaria for 3 months cover. So there are a number of new things we are doing in addition to what has been winning as a fight. And we believe that if you're able to do that, it's going to push us towards elimination.
So you're going to every community?
So we're going to start from 21 districts in Greater Accra.
Why Greater Accra and why not, you know, from the other areas where we assume that people are less sensitized about, you know, malaria and so should get the the sensitization
Great question. It's great. So we've stratified the country into 4. We have areas in this country where malaria transmission is very low, areas where it is low, areas where it is moderate, and then high. So, per the WHO recommendations, areas where transmission is very low, those are the areas you can do the mass drug administration to push them into elimination.
Okay.
Areas where it is high, those are the areas we'll be doing the other intervention like the indoor residual spraying, giving the medicines to school children, and larvicide and all the other interventions.
I see. That's quite interesting. So let's talk about some successes that have been chalked so far. You've talked about it already, but the fact that you're saying that you want to add on to it, so that means that you've made some progress in some of these communities.
So I mentioned the prevalence, and I just want to add that if you look at the prevalence in 2022, even though the country is seeing 8.6 as the estimate for the whole country, Greater Accra is the lowest, 2.0%.
Okay.
OT region is the highest, 15%.
Ooh.
Yeah, so it means we have a lot of work to do in areas.
Why is it the highest? Is it because people are not taking the drugs, or there are more mosquitoes?
So Greater Accra is lowest because usually malaria in urban areas is usually low. There are a number of issues, accessibility to healthcare.
Okay.
The more you treat, the less likely you have parasites in people for transmission.
Okay.
So areas where healthcare is good, you also have that. Of course, environmental issues are also key. And so if you have your bacterial capacity reducing because environmental issues are being managed well, that also helps. OT, I believe that we still have to improve a lot of things in the area of accessibility to healthcare, intervention coverages. If you're able to do that, I'm sure OT will also come down.
All right, so this intervention you're talking about, I think is fantastic. And the fact that you're starting with Greater Accra, eventually you're going to move to the other areas as well. How do you sustain the momentum? Because if you think about it, we don't want a situation where we start off, we're energetic about it, halfway through we're told we don't have enough drugs, etc.
Very good. I think that the first thing is for us to own it. You know, everybody in Ghana should understand that malaria elimination is for all of us. It's not for the health sector. So we all have to identify our roles. The journalists, you have a role. What can you do in the fight against malaria? The politicians, you have a role. So we all have to identify our roles and own it. If you look at what we have to do in the environment, for instance, if you are able to have a very good environment, it reduces the bacterial capacity. So we all have to identify our roles, own it. The second bit is about the interventions available. We have a number of interventions, the nets. I realize you're showing the nets. If you have the net, you have to use the net. You're talking about doing so. if in fact, we always say that it is better for you to sleep under the net when it is hot, naked, than not to sleep under the net, because having malaria is one of the worst things you want to have.
Are you saying once you sleep under the net, you should sleep naked?
No, so what I was saying is that you have to sleep under the net.
Okay.
Even if it's hot, it's better to sleep under the net. And of course, if maybe you live in an environment where you think you can't use a net, we advise that at least you have to use one of the vector control interventions. We have what we call the indoor residual spraying, where you can spray the interior walls of where you stay, right? And the thinking behind it is that the behavior of the mosquito is simple. They bite and then they rest on the walls. If they rest on the walls, they imbibe the chemicals in the walls and they are knocked down. So either you do that if you're not using the net, or you do larval source management in your area.
What's that?
So the baby mosquito, you know, when the mosquito lays the egg, it develops into the larvae and then into the pupa before it becomes the adults. So we usually drop some chemicals, they are not harmful, into all the stagnant waters around. And this is usually done by the assemblies and the Zoom Lion team. We encourage that if that is done, of course, if you are covered with that, you are covered with indoor residual spraying, and you think that you are safe, you don't want to use the net, that's fine. But we really have to use one of them.
I see, that's interesting. Now, as we're marking World Malaria Day tomorrow, I'm curious to find out what the other stakeholders, and I'm saying other stakeholders because you're saying that we all must own it. And so, yes, we'll do our part. But how have the other stakeholders contributed to ensuring that we're able to eliminate malaria to the largest extent?
So, for instance, the area of private sector, we have EcoBank coming on board. They have donated an amount of money, and we are looking for it for more private sector engagement. Hopefully, if we get the private sector to come on board, we'll be able to get more funding for especially the new interventions. So we are seeing the private sector. We are also going to engage the journalists. We're going to be training them so that they can advocate for us. And the parliamentarians have been engaged over the years. And now we have a caucus on malaria. They speak for malaria and they advocate for malaria. We're also going to be engaging the religious leaders, because they are key. You know, some areas, what they tell the people is what they do. And so as we engage them, we get them to talk for us, and hopefully the agenda will be clear to everybody and we'll be part of it.
Agenda will definitely agenda. So thank you so much for speaking to us this morning, and we hope that everyone is on board. Like Doc said, you also need to make sure that you are doing this for yourself and ensuring that you're helping to eliminate malaria across the country. So we'll do our part. And thank you for doing your part too. All right, well, Dr. Nana, relax, don't go yet. Oh, we're spending some more time, relax. Dr. Nana Yapepra is the Deputy Programs Manager for the National Malaria Elimination Program. And today, being Wednesday, it's our health segment. What do you know about throat cancer? Do you actually know that you can survive throat cancer? We have a woman who is going to share an incredible story with us. She's a survivor, and it will blow you away. Don't go anywhere.